Thank you very much, Chairman Kenny, President Gold, and all members of the Board of Regents for the opportunity to speak about this issue today and for your leadership on behalf of our students, faculty, and staff, and the people of Nebraska. I also want to thank all the members of Nebraska Medicine who've spoken, who I highly respect and value as friends and colleagues. I do want to say that I wholly support this transition to sole governance of Nebraska Medicine and explain why. We're at an historic and critical inflection point for UNMC, Nebraska Medicine, and the future of healthcare in our state. Just over a year ago, Nebraskans saw the importance of these two institutions up close when Governor Palin was airlifted from Columbus to what everybody called the Med Center after an accidental fall. The specialized physicians who led the surgical and medical teams that treated the governor were both UNMC faculty members and Nebraska Medicine staff. A reminder that here in Nebraska, education, research, and patient care, and separate lanes, they're integrated in the care we deliver every day. That moment underscored something that I've seen repeatedly as I've traveled extensively across our great state. The Med Center, as we are known, serves as a critical resource, as the last hope for complex, specialized care that patients may not be able to access anywhere else in Nebraska, and most Nebraskans see us as one. Together, our academic medical center, that is UNMC and Nebraska Medicine, combined as a statewide lifeline, delivering advanced care, training the future healthcare workforce, and bringing innovation to patients and communities everywhere. We are Nebraska Medicine UNMC. We share the same logo, we share the same mission statement, and we share the exact same values. Virtually all the physicians who work at Nebraska Medicine are UNMC faculty. Our facilities are intermingled. Our faculty, staff, and students depend on each other. Together, UNMC and Nebraska Medicine are Nebraska's largest employers, employing directly or indirectly 55,000 Nebraskans with an annual economic impact of $7 billion. I have had the honor of over 40 years of service as a physician, and I remain privileged to have the ability to continue to serve patients at Children's Nebraska and Nebraska Medicine. I've also had the blessings of decades of a background in business and healthcare management, and I've served on the boards of directors of numerous great institutions and organizations during my career, including on the board of Nebraska Medicine during the past 18 months of serving as Interim Chancellor of UNMC. I understand and I've seen firsthand the hard work that goes into ensuring Nebraskans get this quality care, have access, and ensure that there is stability and accountability over the long term. I can confidently say that Nebraska Medicine is among the very best run and world-class organizations that I've served and worked. And you can see it reflected in our rankings. Number 1 in the state, 14 straight years. Named to Becker's Hospital Review's 100 Great Hospitals in America. And named number 5 for safety in the country, among other accolades. That excellence is not accidental, but it is due to the careful selection of competent leadership, faculty, and staff who choose to come and work here from across America and around the world, like myself, and many do so because of the connection of a world-class health center in Nebraska Medicine to a world-class university in UNMC. That is why when our long-standing partner in Clarkson has clearly stated that they are leaving the partnership that is Nebraska Medicine, we cannot afford to sit on the sideline and take the gamble of having an unknown entity come in to fill that partner role, but rather have the university itself assume sole governance, as several other major and prestigious universities currently do successfully. Clarkson is not only offering a historically generous package that is worth less than half the appraised value of the interest in Nebraska Medicine, they are also providing a $200 million donation to Project Health, which is critical to the future of Nebraska Medicine. But perhaps more importantly, just as important to me, is what they intend to do with the proceeds of their sale. Clarkson is transforming into a foundation that will focus on Nebraskans with a goal of making Nebraska the healthiest state in the nation. They will initially be focusing on behavioral wellness, which, as we all know, is an epidemic in our state and our nation. For these reasons, I support the transition to sole member governance as we are already virtually the same organization and cannot afford to be divided, and the result is a win-win for the citizens of Nebraska. However, I do also want to acknowledge the legitimate concerns and risks raised by our UNMC faculty, staff, and students, our dedicated Nebraska medicine staff, and the public, many of which have been addressed over the past several days. While the board absolutely needs to retain rights as the sole owner, as has been stated, we'll need to structure the bylaws to ensure that the independence continues. We'll continue to assure all Nebraskans, our faculty, staff, and students, Nebraska medicine colleagues, staff, Clarkson College, the business community, and our donor community, who have been strong supporters and partners, that they can continue to trust their med center, that it is being run by professionals, financially prudent, and be confident in knowing that strategic decisions can be made nimbly and independently without political or other interference. Because at the end of the day, there is no greater treasure than health, and our responsibility is to protect that treasure for every single Nebraskan. For my part, if this historical vote is taken affirmatively, I will work diligently to ensure that I represent the voices and concerns that have been raised of all the stakeholders in ensuring that this vital Nebraska asset continues to remain the very best in our nation and among the very best in our the very best in our state and among the very best in our nation. Thank you very much.